Hello, this is Dr. Jazayeri. Everybody knows us as Dr. J. I wanted to talk to you today about tummy tuck and some of the things that I've noticed to obtain the best result. One thing that people sometimes ask me is the body mass index. So there's a formula, it's also called as BMI. There's a formula based on the height and the weight, and we look at the BMI of the patient. Some patients email me, or come and they're concerned that their BMI may be too high for a tummy tuck. So it depends on where that extra, mass is situated. I've done a patient of mine whose BMI was about 37, which is high, but when I looked at her, all the fat and that weight was in her legs and hips, and she had very loose skin, thin skin in her abdomen, and so we did a tummy tuck on her and the result came out beautiful. There is some data that if your BMI is over 30, that there's a potential for more wound healing complications. But again, if the BMI is not in the stomach area where we're doing the surgery, I don't think it makes that much difference. If the skin is loose and there's not a lot of fat, I think that area will heal fine, and I haven't had any issues. Now, in some patients, even if their BMI isn't very high, if they have a lot of fat in the upper part of the abdomen, so let me stand up. So if, let's say there's loose skin here, but this area, there's fat here, okay? And the fat is a good amount, even if it's a small amount. I have to see if that skin is mobile. If the fat is in the way, I just can't do a good job. I'm limited by how much of that skin can get pulled down. So the patient then, has several options. Obviously, the least expensive is for the patient to lose enough weight until that skin becomes thin and mobile. And then when we do the tummy tuck, she'll get a good result. The other option is we can liposuction the area, and then I usually wait 3 to 4 months for the swelling to go away, and then I can do the tummy tuck. There are some surgeons who liposuction and do a tummy tuck at the same time. If you look at these doctors or these people who are doing that, there's a concern with the blood supply. When we do a tummy tuck, and I'm going to stand up again, so there's a blood supply coming straight up from the muscle up here. There's one down here. And the third one is coming from the side. So the blood supply comes like that. When we do a tummy tuck, because we're raising the skin, these two blood supplies are completely gone. So we're relying on this blood coming all the way here and feeling the stomach skin. So if we lipo this area too aggressively, the blood supply to that skin may become jeopardized, and the patient may end up with large wounds that take months to heal, and then they have ugly scars. So if you look at this, the recommendation is to liposuction only the deep fat and not to do too much lipo. Well, I don't know what that means. Unless I have an ultrasound, I could be going into the superficial fat compartment too. There's two fat compartments. So why take the risk? This is not cancer surgery, In my opinion, it's best to just stage them, either lose weight or the patient can lipo, and I can lipo aggressively because I'm not worried about the blood supply. We wait 3 to 4 months, and then we can do a tummy tuck. That's my recommendation. And again, there are some patients who may not have a lot of fat, but any fat in the upper abdomen, again, I'm going to stand up, even if it's a little bit of fat, when I pull the skin, it will do that, but there's still, from the side, there will still be a little bit of a bulge, okay? And that's just the fat that's pulled down. And I always tell the patient this, and I tell them, you don't have a lot of fat there, you're going to get a good result. But remember, once I pull that skin, if you stand from the side, instead of being completely flat, you could have a little bit of bulge in that area. And that way they're prepared for it, and they understand that, yeah, I can do a liposuction later on, or or do I lose some more weight? So that's important. So the BMI, again, we'll look at it, but it's not black and white always. I have to see the patient. If the patient has excess skin in the upper abdominal skin, which needs to be pulled down, if the fat is too thick and non-mobile, that somehow needs to get thinned out, either by weight loss or liposuction. And I don't recommend doing these together. It's just you're asking for potential problems. Well, I hope that helped. If you have any questions or you want to look at some before and afters, please visit our website, www.drjaz.com, drjaz.com. All right, thank you. Bye-bye.